I'm going to talk about Perthes disease, which will be a continuation for the case limping child. As you can see, this is the X-ray, and I want you to look at this X-ray and see what's wrong with this X-ray. And after we go through Perthes disease, you will be able to know what's going on here. So, what is Perthes disease? Perthes disease is usually seen in 4 to 10 years, male more than female, Caucasian more than East Asian and African Americans, bilateral in 12%. The cause is because of the idiopathic avascular necrosis. It is because of the idiopathic avascular necrosis of the capitofemoral epiphysis due to interrupted blood supply. This is the important thing. Idiopathic avascular necrosis of the capitofemoral epiphysis due to the interrupted blood supply, as you can see in this picture. There is interrupted blood supply, so because of skin injury, see, as you can see here. So in examination, as you can see, there will be stiffness, loss of internal rotation and abduction, and gait will be antalgic, and can see Trendelenburg gait. And as we know, the Trendelenburg gait is an abnormal gait where there is lurching to the affected side. Lurching to the affected side means the side where there are weak abductors. As we can see here, if there is weak abductor, what happens is, in this side, there will be lurching to the affected side. As you can see, the normal gait and the abnormal gait. And the risk factors are, number 1, positive family history, low birth weight, abnormal birth presentation, secondhand smoking, Asian Inuit, and Central European descent. And going on with the investigations, what we can do is MRI is actually, it's very helpful for diagnosis of an occult and early disease diagnosis. And the usual important investigation that we do is X-ray for pelvis and frog leg lateral, which is helpful in diagnosis and prognosis. And early finding includes usually the medial joint space widening, the earliest from less ossification of the head, and measured between the teardrop and calcification center, irregularity at the femoral head ossification, decreased size of the ossification center, sclerotic appearance, and the crescent appearance sign, the crescent sign represents the subchondral fracture. I hope you can remember this. And usually in Perthes disease, the aim of the treatment is hip irritability, to eliminate the hip irritability, restoration of the range of movement, and prevention of the capital femoral epiphysis collapse, and attainment of the spherical femoral head during healing. And usually the management is non-surgical and surgical. Surgical can be cast and arthrosis. Surgical can be femoral and pelvic osteotomy. And age, while treating, you have to remember about the age. If it's less than 6 years, expect an observation. If greater than 6, it's surgery. I hope you found this helpful. Thank you.